Massachusetts General Hospital was established in 1811 and is a 1,000-bed academic medical center located here in Boston. MGH is ranked consistently as one of the top hospitals in the United States and across the world. One of the largest teaching hospitals for Harvard Medical School and have the largest hospital-based research program in the country. So when we think about our residency program, we've really worked extremely hard over the last couple of years to make it one of the top programs in the country, both from our preceptors that we've recruited and from programs throughout the US, to really working to recruit and match the best residents across the country. And I think what really makes our program unique is that we do have such diversity of both our preceptors, our rotations, as well as our residents that have really brought that all into one place here at MGH. I think we have an outstanding history here at MGH in terms of our, not only the pharmacy department, but our institution, and the excellence that is really required to be a resident here, to be a staff member here, to be a leader here. And we would expect that of all of our residents as they join our team.
At MGH, we offer a variety of rotation options, anything from internal medicine to neurology ICU, to surgical ICU, to substance use disorder rotation. We have many inpatient and ambulatory care rotation options, which I think provides a wide variety of options for people who are interested in doing various different things at MGH. We also have plenty of PGY2 options available as well, ranging from emergency medicine to infectious disease to the intensive care unit.
One of the aspects of working at MGH as a pharmacy resident that really appealed to me was being in a big city at a level 1 trauma care center. During orientation, we were given a very extensive training in ACLS, and this was a great opportunity for me as myself to learn more about emergency medicine. Not only was I working beside my fellow residents, but once we were fully trained, we attend codes independently and get to work with the healthcare team. And this is just one thing that really stood out to me about working at Mass General.
One of the reasons I chose MGH was because of its location. I knew I wanted to be in a fast-paced environment, and I know Boston will offer that opportunity. I'm working alongside other medical professionals, not only physicians, but also nurses, nurse practitioners, and other students that are training to learn from the best. Here at MGH, I have this opportunity every day while grinding with the team, working on cutting-edge research with the transplant team that's here, and also working on other opportunities for education in other pharmacy fields.
Education is one of the pillars at Mass General Hospital. As such, pharmacy residents work hand in hand with medical residents, nursing students, as well as attending physicians to all learn in a patient care environment. Our residency strength is the ability of residents to directly interact with both patients and providers to optimize pharmacotherapy. We believe strongly in the educational mission of the hospital, and we do everything that we can for the pharmacy residents to align with every aspect of patient care and ongoing professional education.
One of the greatest things about MGH is being next to my co-residents, whether that's discussing patient care related things or eating at the Bullfinch lawn. Everything that we do is always a great time, and so that's one of the main reasons why I love MGH, a part of everything else, like working alongside the best team to provide the best patient care, as well as collaborating with residents and attendings that love to hear pharmacy's input.
I feel like our relationship with the residents is a melding between being a mentor and a colleague. Not only do I get to see them as a preceptor while on rotation, but I also get to help them with their struggles between professional and interpersonal challenges throughout the year. It can be a rigorous program for our residents, so I want to make sure that we're there and that we have an open door policy and they know that we are there to help them grow.
As the PGY1 administration resident here at MGH, I have been extremely lucky to have both mentors from the clinical perspective as well as my mentors on the administration side. So technically my advisor, my mentor, is one of the managers, but I've been lucky in working on several clinical projects with the clinical preceptors as well, who have been amazing mentors with my MUE and a few other student projects that I've gotten to work on. So each of those mentors have been very attentive to what my personal goals are, including more teaching experiences, and they all have been very helpful in getting me those experiences and tailoring my program to what I'm looking for.
At Mass General, we believe residents should be involved in every aspect of clinical research, from its inception to its design Through moving through the Institutional Review Board, we believe that residents should see all aspects of research, and we believe strongly that they will have a solid foundation for future training.
Moving from St. Louis to Boston for residency was definitely a little bit scary and nerve-wracking, but I've been extremely lucky in having an amazing and supportive residency class. We have a group of 9 of us total, and then including the few PGY2s that have been here, been very helpful in transitioning us into the program, giving us all the important details and tips and tricks of being a successful resident. Additionally, with the support within the program and during the workday, we also still spend a lot of quality time together outside of the workday. So, for example, we've been going apple picking together, having taco nights, movie nights, really any type of exploring Boston activity that we can think of. We've been still trying to unwind and do that kind of stuff together, which has been an amazing opportunity to get closer with my class and learn and grow together this year.
A definite advantage of being here at MGH in Boston is the community we have around us. And just being in Boston in general, it's a beautiful city, which I really have come to realize and appreciate during my time here at MGH. I feel that the patient population is very complex and something you won't see in other hospitals, which is why I chose MGH.
Our residency graduates have gone on to succeed in a variety of roles, including advanced clinical practice, academia, industry, and leadership. It's important to note that these roles are not just local or regional, but in many cases, national level roles.
Our residents get to see very extremely unique cases that they're not going to see at other hospitals. I think when we talk about Boston, Boston's a great area, and people have questions about, is pharmacy practice as advanced as other parts of the country? And I would say with confidence that here at MGH it is. Great preceptors, a strong structure for our program, and outstanding residents have really made our program, taken it to the next level, and I would say one of the top programs in the country.